To assess its function, first be sure both nasal passages are patent.
Any problems?
No.
Then, with one of the patient's nostrils occluded and his eyes closed, pass a mildly aromatic and familiar substance, such as vanilla, cloves, soap, or coffee, under the open nostril.
Alcohol.
If the patient detects the smell, ask him to identify it.
Breathe in.
Repeat this test on the other side.
Cinnamon.
Cranial nerve 2, the optic nerve, mediates vision.
I'd like to test your vision now. If you could hold.
To assess its function, check the patient's visual acuity and visual fields and inspect the optic fundi.
Can you read the numbers on that?
If a
line?
Snellen chart is not available, test
9,
visual acuity
3,
by using a special handheld
7,
eye card.
8,
To do this, ask the patient to
2,
cover one eye, hold the card about 14 inches away from his eyes, and read aloud the smallest print possible.
4.
If the patient requires reading or general-purpose glasses or contact lenses, he should wear them.
Can you cover up the other
Then
eye?
test the other eye.
Thank you.
For screening purposes, visual fields are tested by
Now I'm going to test your
confrontation.
peripheral vision.
Face the patient directly and imagine a glass bowl encircling the head.
Towards the center.
Ask the patient to look with both eyes into your eyes.
Point when you see
Then place your hands about 2 feet apart, lateral to the patient's ears. Then slowly move the wiggling fingers of both hands along the imaginary bowl until the patient identifies them. Repeat this action in the upper and lower temporal quadrants. Normally, a person sees both sets of fingers at the same time.
I'd like you to cover up your left eye.
If you think you've found a visual field
I'd like you to
defect,
say now,
such as
when you
loss
see
of
the
vision in the right temporal field, slowly move your wiggling fingers from the defective area of the field toward the better vision. Repeat this at several levels until you can define the border of the defect. These responses suggest a defect throughout the temporal half of the
Cover up
field.
The other eye.
Test the other eye for an accompanying defect.
Look straight ahead at me.
Next, inspect each ocular fundus by using an ophthalmoscope. Assess the optic nerve by inspecting the optic disc. Note its color, the sharpness of the margins, and the width of the physiologic cup.